Dzień dobry Państwu. Jesteśmy w trakcie pierwszego kongresu kardioonkologicznego w Warszawie, wielkiego wydarzenia międzynarodowego. To jest też czas, gdzie możemy spotkać się z ekspertami z całego świata. Mariana Mirabel from Paris, my friend from ESC. Mariana is cardiologist and oncologist. Is one of founder cool group young cardiologists, cardio-oncology interests. Mariana, we very often hear that cardio-oncology is difficult. We hear from colleagues that ESC guidelines are too complicated, contain a lot of oncology and hematology information. Do you believe it's possible to be a good cardio-oncologist without knowledge about oncology or hematology? It's possible to provide comprehensive cardiac care for patients with cancer without knowledge about type of anti-cancer treatment?
Thank you for your question. Indeed, it is a challenge. We need to educate our cardiology community to the basics of oncology, hematology, and how to care for patients who have either active cancer or who have had cancer in the past, to look for the right cardiovascular complication, because the complexity of cancer therapies is leading to more complex cardiovascular toxicities well beyond heart failure. So indeed, it is really important that we all train and we have a basic knowledge of what to expect. And for that, the European Society of Cardiology is releasing the first level 1 accreditation in cardio-oncology. The examination is in December the 9th, and the courses are already online. So please do join us in order to increase your knowledge and be a better cardiologist for all the patients.
Yes, great. I completely agree with you. And I have second question. You are very young. You work with young cardiologists, young specialists. Could you give us 2 or 3 advice how young cardiologists can start work with hematology or oncology patient with cancer? How can improve skills and knowledge in cardio-oncology?
So indeed, it's a very good question. So first of all, you need to have some basic training. That is the one from the Cardio-Oncology Council of the European Society of Cardiology. That is already online now in 2025, the first exam. Also, you can join the ESC Council. It's for free for the time being, and then you will have a lot of educational content with a monthly newsletter that summarizes the most important articles that have been published in the field. And at last, to build a cardio-oncology service, the first thing is you need to go to the oncologist, to the hematologist, and ask them as well what do they think they need, and help them to increase their knowledge in cardiovascular disease. So it's really about teamwork.
Yes, great. And last question. What do you think about working young cardiologists under supervisor of expert? I think it's very important because all of us start something. You work with oncology about 10 years or more, and when you start, you have a supervisors. I think it's very important because for us practice is very important, but we need support from cardiologists, for doctors who is more advanced in cardio-oncology.
Indeed, having a mentor who has already trained, has cardio-oncology expertise is a plus. Unfortunately, it's not available for everybody, but if you do have that, it is fantastic. When I started, there was none. But yes, it is something that is advisable.
Great. Thank you very much. Thank you for coming to Poland. I hope we will see during next second edition our conference. Thank
Indeed.
you.
Thank you very much.
Bye.
Bye.